I'm Ian Barnes. I currently work in NHS England. I'm currently leading a review for Sir Bruce Keogh on quality in pathology. Pathology deals with data, it deals with patient results, it runs very complex systems. It covers most of clinical pathways from end to end, from GP practices right the way through to discharging patients and specialist testing. It's terribly important that we have good IT to run integration of our systems and to provide relevant patient data. I hope they will come out, the summit will come out with an integrated, unified approach to how we should be taking IT forward in pathology in the future. Currently we have a lot of disparate systems in pathology. They're not very well integrated. We're not very well integrated with hospital systems or GP systems. So hopefully an agreed way forward will come out of this, because we need more standardization, harmonization of the data. Really very important. Well, reaching agreement, first of all, on what we should be doing is a challenge. Secondly, the systems that we use at the moment are not very standardized. I think we really need to work in partnership collectively with the IT suppliers, with pathology professionals, and remember, we're not a unified discipline. We have 5 or 6 different disciplines which constitute pathology. So I think really we need to try and get a common approach to that. And really important for me is we need a collective integrated approach to drive the pathology agenda through. We need to raise the profile of pathology within healthcare, because we're incredibly important to virtually all clinical pathways. 70 to 80% of a patient record will contain pathology data. And I don't think healthcare generally places enough importance on pathology. So I think if we can have a collective response from the summit, we can work collectively in the future to drive the agenda for pathology, both through the NHS, through the Department of Health, and at local level, of course. I think that will make a huge change and improve the quality of the service we provide. I've been doing this job previously in the Department of Health as National Clinical Director for 10 years, and information technology has been constantly on the agenda. And we've been through many initiatives before now. We are good at coming up with strategies, but we're not as good at getting the implementation that we need. And hopefully this time, I think, with the transparency agenda coming out of mid-staffs, for instance, the way it's driving in the NHS into patient focus, communicating with patients, this is a huge opportunity for pathology to be seen as a clinical service, not as a back office function. But we need good IT and good communication systems to be able to do that.